Dr. Zwelling arrived in Los Angeles in 1980. She's been around for a while. Not as long as some of us, but. And completed her residency training, both in internal and emergency medicine at Harvard UCLA. She achieved her board certification in both specialties and went on to certifications in critical care and quality assurance utilization review. So we've got a very high-powered speaker here with us tonight. Dr. Zwelling served the community as an ER specialist for 6 years before opening primary care practice in Los Alamitos, okay, right up the street, in 1987. She was widely recognized as a physician who would go to extreme lengths for her patients, helping them navigate the increasingly complex and troubled healthcare system. So without further introduction, Dr. Zwelling, if you'd like to take the podium.
Good evening. Thank you so very, very much for having me here tonight. I know many of you, some of you are my patients and my friends. I'd like to tell you a little bit about myself, a little bit more so you understand my bias. I think everyone comes with a bias, and it's very important that you understand where I'm coming from. I was born in Zanesville, Ohio. That's redneck country, Appalachian. And my uncle ran for office when I was little. He was a Democrat. And indeed, my mother would dress me up like Uncle Sam and put placards on me, and people would slam doors in my face and explain to me that they weren't voting for my uncle. Interestingly enough, he's the only Democrat to ever been elected in this Republican area because he's a very middle of the road, very moderate. And he was a good judge, and now he's a mayor. And he actually is working with Governor Kasich, so he's a good guy. But I'll tell you a little funny story. When Obama was running for president, and of course Ohio was theoretically the swing state. And my parents are actually pretty liberal folks. I love them to pieces. My mother has since died, but they're pretty liberal. I explained to them that if Obama won in Ohio and he won by 2 votes, I would have to kill myself. So they voted the right way. I don't know how I came to be a conservative, except that I must tell you that I so believe in this country. As much as my father, I think, was a lot more liberal as I was growing up. He was a pilot, a P-47 pilot, and I grew up in a family that only talked about how wonderful it was to be an American. So that's where I grew up, and that's all I really understand. And I come here today with that bias, if you will. I am a doctor. I introduce myself as my patient's doctor. I am proud to be my patient's doctor, and that's what I do every day. I don't have children, so I'm able to stay in my office longer and give my life to my patients. They are my family. I love them. They're my family, my friends, and we have a pretty good time. I think if you talk to any of them, you'll know that we have a real good time. I was an economics major at Wellesley, and that's why I kind of know what I'm talking about. I actually wrote the literature behind most of health economics today. That was purely an accident, quite frankly. Many of you are old enough to remember the Nixon wage and price controls. And initially, I went to my mentor and I wanted to talk about the Nixon wage and price controls. I wanted to see what happened in a sector of the economy that was basically just kept controlled, if you will, while the rest of the economy was allowed to do its thing. And then, of course, the controls were removed, and I wanted to see what happened. And I went to my local hospital near Wellesley, Newton Wellesley Hospital, and I walked in. They didn't have HIPAA then, so I had access to everything. I spent the day there, and at the end of the day, I went into the CFO's office, and I said, "Do you even know what it costs to give a shot of penicillin around here?" And he said, "Not a clue." Because hospitals at that time didn't know accounting. They didn't know cost accounting. It was all cost pass-through. I went to my hospital in Zanesville, Ohio, and I got the same answer. So I went back to my mentor and I said, "Oops, wrong study, can't do it." But one of the things I did notice was that the cost of healthcare was very different in every demographic community. And so I based my literature on the fact, on questioning why healthcare was differently priced in different demographic communities. And you'll be interested to know that actually it is the only one variable that makes any difference at all is the number of doctors on staff at the hospital. At the time, doctors were the suppliers and the demanders of care. Patients came, they had a complaint, we told them what they needed, and then we sold it to them. The hospital was our capital playground. We didn't have a dime invested, but they gave us everything that we wanted. And so the cost of healthcare grew and grew. We got Medicare in 1965, and that was, as much as I know every one of you here loves Medicare, believes in Medicare. The Medicare and the fact that we had third-party payers paying for care was actually the reason that the cost of healthcare continued to grow. And we're going to talk a little bit about that. Because in the end, this is your life. And what I'm going to talk about today is that this is your life, this is your investment, it's your choice. And of course, that's really the tragedy of Obamacare, isn't it? It isn't who's paying for it, it's the fact that your choices have been taken away, that your discretion has been taken away, and the one thing that our forefathers fought and died for was your right to self-determination. And I will work until I have no fingers left to make sure that you are left with the rights to choose your own life. So I thought that I would explain a little bit about Obamacare. This is my passion. I believe in this. I will help you any way I can. What I can't describe here or what questions I can't answer, I'll find you the answer, just like I tell my patients. If I don't know, I'll find the answer. I really do answer my phone 24/7 and my emails. You can have access to me. I am actually paying for this to be videotaped tonight so that you can have this speech be available to you for PR or to look back on for anything that you need. So this will be available to you or to your friends forever. Do with it what you want. Just don't throw darts at it. So with that in mind, let's talk a little bit about Obamacare, and then we're going to talk about what you can do to preserve your rights, because that's what this is about, right? So this is an overview of Obamacare. First of all, why did we need this thing? What was the promise? For the most part, most citizens in this country were concerned about the cost of care. That was what everybody was talking about, if you'll recall, right? The cost of care, cost of insurance was going up, your health care was more expensive, you were paying for pharmaceuticals, no one could afford it. And so Obamacare promised us that we were going to take care of the cost of health care. Quite frankly, even today when they do surveys around the country and they ask, what is your issue? The issue is still the cost of care, quite frankly. It's still too damned expensive. You know, if the rent is too damn high, well, the cost of health care is too damn high. So the promise was that we would have more affordable care. The promise was that you could keep your insurance and your doctor. The promise was that we were going to save business. We were going to decrease the national debt, and we were going to have fewer uninsured. Great promise. I'm going to show you that not one of those promises has come to fruition, and it can't, because the law makes no economic sense. And if you know anything about economics, and you do, it has to make sense. Economics is about life. It's time and money, right? Everything is time and money. If it doesn't make sense, you're not going to buy it. You're not going to waste your time. And in this particular plan, the costs are high because, not because you want to buy those things, but because you're made to buy those things. So it isn't affordable. What you'll learn and what I'll show you is that the number of uninsured hasn't gone down, and quite frankly, it will go up. And we did talk about the fact that there will be longer lines, less care, rationing, all that kind of stuff that, you know, the politically incorrect things to say, but it is the truth. The reality, already, insurance premiums have gone up. Now, I know that I'm speaking to, in large part, a Medicare audience, but your Medicare premiums have gone up, right? And how about those secondaries? Is that not the most ridiculous thing in the world? So, you don't have to have any medical problems, but you're spending a lot for your insurance coverage. And quite frankly, one of the things that I'm not going to dwell on today, but I want you to give this a little thought. What choice do you have? How many of you have a choice outside of a Medicare-type product? The answer is none. The fact is that the Medicare system in the United States is the most socialist system in the world, that every other country in the world, and I mean every other country in the world, excepting Canada, actually allows for people at the age of 65 to buy their care. You can't do that easily in this country if you have Medicare. In Canada, the province of Quebec actually, it's stated they actually took this to court. The Supreme Court allows people now to bribe private care, and it's very interesting how they came to that answer. The Supreme Court said to the province of Quebec, if you can provide reasonable care for people, then indeed we will let you continue to provide that care. But if you can't provide care in a timely fashion, then people should be allowed to purchase it. And they gave them a year to make things work. They couldn't make things work, so they allowed people to buy their care now. Outside of that, of course, you know, we see a huge influx of people from Canada to the United States. Why? They want the same choices you do, and they don't have those choices in Canada. On the other hand, if you go to Florida, and if you go to France, or you go to Czechoslovakia, walk down the street, and you'll see small clinics. And if you ask just ordinary people like you, like me, where do you get your care? They'll tell you they buy it from the clinic. They have a doctor in the clinic. So as much as you've heard that other systems work where everything is a public system, that is actually not true. The Medicare system has no competition, and we're going to talk about that. It needs competition. You need choice. You don't have choice right now. The national debt, I surmise, is going to be increased to about 10 times what we expected. Now, can anyone name one program in the government, one program that came in for less money than they said? Give me one. Give me one that came in for less than even 10 times. And as you'll see later in the talk, even Medicare, when it was projected back in the middle and late 60s, they projected the cost at $12 billion, and it came in 1990 at $100 billion. So, I mean, $1 trillion, we're talking tens of trillions of dollars, money that we don't have. The economy has been in a total disarray, and I think that this is very important. Do any of you own private businesses right now? I own a private business. I need to know what the financial landscape is going to look like, right? You need to know where you can spend your money, what you can offer, how much you can offer your product for. You need to be able to invest in your business. How can you do that when you don't even know what the cost of healthcare is going to be and what your responsibility is going to be towards your employees? It's damn near impossible. And so Obamacare, and the fact that it is so, well, of course we had to pass the bill so we could know what was in it. I read it every damn word long before, Pelosi ever read it. But the fact of the matter is that bill is so ambiguous and so disruptive that we cannot get our economy back on an even playing field. We cannot start employing people until we've decided this issue. We must decide this issue one way or the other so that employers can understand what they need to do in their business so they can make investments. That's economic common sense, right? Right. More reality, you will lose your doctor. That is just the truth. My colleagues, we sit at the dining room table at lunchtime, and all my colleagues, Dr. Narayan will tell you, don't they just, they bitch and moan. And it's not, they can't do their job. Now, my bias is that I have a different kind of practice. I don't take insurance. My patients pay me for their care. I have a limited number of patients. They can call me 24/7. They can email me whatever they want. And if it's 10 o'clock at night, I'll meet them in the ER. Or if it's 8 o'clock on Saturday morning, I'll do the same. But it's what I do. It wasn't ever about the money. It was about being able to do our job. What you hear doctors talking about is the inability to do their job. I mean, what can you do with both hands tied behind your back and, duct tape across your mouth? Not a lot. And doctors are professionals. My colleagues want to do a good job for you. But you can't when you have rules and regulations that just absolutely overwhelm your day. And don't let you look at that person sitting in a room and ask them, how can I help you, Mrs. Smith? But how many of you have called up a doctor's office and the first question is, what kind of insurance do you have? Now, is that the most insulting thing in the world? It is. And doctors hate to ask it, but indeed, that's what the marketplace has become. So doctors are not happy. They will leave Medicare. Medicare doesn't pay them well. It pays them probably 10 cents on the dollar. And you just can't continue to run a business like that. Volume can only go up so high. And so I think you'll see a lot of doctors leave the system. Depending upon what kind of machinations are done financially, ACOs or whatever other kind of financial ramifications become the eventual reality, doctors will find that rather than clamoring for each other's money, they'll either retire and go sell donut holes, or they'll go out on their own. But indeed, some of my colleagues are retiring early. It's really very sad. These are professionals, invested a lot of time and effort, want to help you, can't. That's just not a good place to be. And if anything, you should be able to choose the person that you trust and you love to help give you the best advice that they can. That's what we do, that's what we want to do. That's not what Obamacare allows us to do. There are over 100 committees and commissions, and for those of you who have heard me talk before, this is the malignancy in Obamacare. These committees and commissions, which by the way have already been appropriated, and all sit in the Department of Health Service. This is the executive branch of government, by the way. You don't elect these people. You don't elect a CBS. Of course, she had to be approved by the Senate, but you did not elect her. And all the people that she brings into her office place, you don't even know them. The committees that set up the IPAC, these are 15, I know these people. I know it took 5 minutes for that committee to be arranged. This is the committee that will basically decide what's good, what's bad, what's allowed, what's not. My cousin, actually, the famous Zwelling, Lenny Zwelling, was actually a Robert Wood Johnson Fellow and sat there and watched this committee be formed. It took them 5 minutes. Of course, it was all prearranged. You don't know these people. They have never worked in a doctor's office. They may have MD by their name, but they don't have your interest at heart. This is all cost controlled. Now the interesting thing is I went to Congress and I said, come on, Mr. Congressperson, why are you giving up your discretion? They don't want it. They tell me flat out they don't want it on their plate. It's become an election issue and they want it off their plate. What that does is it gives you no choice. So it all sits down in the Department of Health Services. Let me tell you about some of those committees. Remember the student loan program? The student loan program is all part of this as well. So the government will decide who goes to medical school, what specialty they're in, what medical school they'll get to go to, what specialties those medical schools will actually educate, how many residents and fellows will be allowed to be educated. All of that will come from the federal government because medical school costs $250,000 a year for the 4 years. When I went to school, to show you how old I am, it was $6,500. And that, almost took us, But it's $250,000 of debt. So you either have the very rich or the people on student loan programs that the government will be giving student loans to. Well, imagine if the guy who's going to decide if you're going to be a doctor is the government. This is a conflict of interest, don't you think? I think so. Now, also other committees, this is a committee about what kind of care is going to be cared for, where the medical schools are going to be, as I said, all the kinds of rationing programs, all these things sit in committees and councils that are all supervised by the Department of Health Service. Now, the truth is that there are some regulations that come from there, and as much as the health bill itself was 2,700 pages, the regulations are already 6,500 and growing, and there will probably be tens of thousands of pages of regulations. You can write about those regulations if you have the time to read about them. You can go online and you can see what those regulations are and you can make some comment. I don't know how much power we have to change that, but you can make comment. Personally, we have to get rid of the committees and commissions. We have to put these things back in the hands of doctors, and we're going to talk about that in a little while. You have to put these things in the hands of the people who give a damn about your lives and your children's lives and your family's lives. We talked a little bit about the student loan program. So, the first thing we set about to do, remember the uninsured, the 46 million uninsured? Well, there really aren't 46 million uninsured, and I won't bore you with all of the data. But understand that is actually, if you went out today and looked at every uninsured person, there would not be 46 million uninsured people. Over the course of a year, there may be several million, many millions of people. But there are people who are uninsured temporarily because they lose work. There are people who don't buy insurance. They don't want insurance. Why should they have a choice? That's what the mandate question is all about, right? Why do I have to buy this product if I don't want it? Those who prefer not, it's interesting that 14.6 are uninsured. Do you know how many people are uninsured in the state of California for car insurance? 14.6%. And almost every single insurance marketplace, regardless of the mandate, regardless of the law, there's always 14 to 15% who choose not to. That's just what happens. 50% of the people people either think they aren't going to get in trouble, God bless them, I hope they never get in trouble, decide that's not an investment they want to make, but didn't we just pledge allegiance to choice? This is choice. They get to make those choices. And I don't think that we should be taking those choices away from them. That, of course, is what the mandate question is all about. We'll see how that plays out, and we'll talk to that in about a moment. Of course, the illegal immigrants who are also uninsured are about 5.2 million. Those people we're paying for too, you understand. We have federal law, again, it's called EMTALA. Every person that comes to an emergency room gets care. Have you ever been denied care in an emergency room? No. And that's by law. So a woman who brings in 5 children because they have a fever, they all get care. Whether or not they need it, it is not our decision. And in fact, you're not even allowed to ask what kind of insurance somebody has before you administer the care. You have to take care of them first. Now, granted, there was a lot of what we call dumping, where doctors would say, I can't see you, and patients left the emergency room. There were a lot of bad things that happened. I'm not suggesting that, doctors are angels by any manner of means, because we're not. But I'm also suggesting that making a mandate that every single person has to be seen in an ER really blocks up our ERs, those who really need emergency care. How many of you have waited 4 or 5 hours in an emergency room? That's just disgusting. And what's going to happen with this law is, of course, there won't be doctors, and there won't be people taking insurance, and so the lines in our ERs will only get longer. And that's disgusting. An emergency room should be there for emergencies, and when you walk in, you should get care, then and there and now. The penalties. There are huge penalties in Obamacare, and we can talk about this forever and ever, but I'll just mention a few of them. Starting in 2014, you know that everyone theoretically has to purchase a plan or you get penalized. Starting in 2016, there'll be 16,000 new IRS agents who will be enforcing the law. Now, they tell me that they're not going to go into my bank account, but if I'm due a refund from the IRS for my federal taxes, they will not give it to me, so they will take refunds. That's what we're told is going to happen. I have no idea how they're going to enforce it, but I do know we're going to be paying for 16,000 more federal employees. Oh, good for us, okay. And here's where it gets kind of interesting. The penalties are up to $695 or 2.5% of your income, equaling about $173 a month, up to a maximum of $2,000. Now, I'm a pretty bright lady. We just talked about economics. So my insurance costs my husband and I about $1,000 a month, and we, by the way, have never used it, not once in our entire lives. $1,000 a month, $12,000 a year. Do I want to pay a penalty of $2,000, or do I want to buy my insurance for $12,000? What? Let me think. Hello? So the plan is set up so that no one could possibly want to buy insurance. Now, I want to talk to you for a moment about this thing. There are more penalties. An employer, those of you who have small businesses, who have employees of 50 or more, if in fact you don't offer this, the federally approved system, this is important, it has to be federally approved, it has to be the huge benefit plan that the government wants, you will pay a fine of up to $2,000 per worker, but the first 30 are exempted. So imagine an employee, instead of hiring somebody new, they're now paying the government this fine for not being able to afford the insurance that the federal government has mandated therefore. Even if he or she offers insurance, this is very important. But if the employee chooses a federally subsidized program, the employer is still penalized. Yes. Now, what happens is that if the company pays less than 60% of the cost of the benefits, or if the premium costs the worker more than 9.5% of his or her household income. So if you're going to hire an employee for $100,000 a year, then it's likely that the insurance will cost more than that, and you'll be cool. But what if you hire somebody who makes only $20,000 a year? You're going to be penalized because, as you can see, the cost of the premium is more than 9.5% of the household income. Because remember, everybody gets the same insurance. Very important. Whether you want it or not, every man in this room is going to get fertility care, whether you want it or not. So, this will actually make hiring the lower end worker very difficult. because nobody will be able to afford it. You'll be penalized. And so I think that indeed what we're seeing is just basic economics here, economics that don't make sense. There are subsidies, of course, for individuals and families, and in the state of California, for a family of 4, you know, if you have a family of 4 and you're making $88,000, that's not a lot of money. But if you live in Ohio, that's okay. But you're still going to be subsidized. Remember, everybody's the same. So there are huge subsidies that are going to go out there for people who perhaps are on the margin, perhaps not. And one of the messages that I just can't get across enough is being poor does not mean people are stupid. Can we get over that? There are a lot of poor people who work very hard. They should not be treated with any kind of deprecation whatsoever. They deserve the same respect as everybody else. Our congressmen treat them like they're stupid, and I think that that's just disgusting. That said, what we have here is, you know, theoretically, because God forbid they're poor people, a gentleman teacher who's teaching in school, who has a family of 4 is poor. Stupid? I don't think so. Choice? Yes. But indeed, they'll be subsidized, and in being subsidized, they're going to be subsidized into the federal system, which basically means Medicaid. Not fair. Absolutely deplorable. These are the tax increases under Obamacare. This is important starting now, of course. Starting in 2013, individuals with incomes over $200,000 and families with incomes over $250,000 will see a tax increase from their Medicare payroll tax from 1.45% to 2.35%. Starting in 2013, individuals and families with incomes over those amounts will see a 3.8% tax on unearned income. That applies to you people. Remember, everything that's in that 401k is unearned income. That's all going to be extra taxed. That's extra taxed. Profits that you earn from selling your home, if your home over $250,000 for an individual, $500,000 for a family, will be also taxed at 3.8%. Those are huge, huge taxes. And of course, the taxes start before the law even goes into effect. So it's being paid for many years before it ever starts to go into effect. None of these taxes are indexed to inflation. That's very important, because what $200,000 is today, in 20 years, it'll be worth about $92,000. And the same taxes apply. In 50 years, that rich person would earn about $29,000 or more at the current rates of inflation. Not a good thing. Pharmaceuticals are being taxed, $2.5 billion in 2011, $3 billion in 2016, and medical devices are taxed. Who do you think is going to pay for the taxes on pharmaceuticals and medical devices? Hello? More taxes. This is really a fascinating thing. This has started already. The FSAs, you know, you have FSAs and HSAs. Do any of you have FSAs or HSAs? And you can pay for your pharmaceuticals out of that special fund. It's a great idea. You can put money into a fund. You can save it until you're 65, never touch it, and now you have something to pay for long-term care. It's a great, great, great idea. Allows you a lot of discretion. And if you want to go buy cough syrup for your children, or you want to go buy Prevacid because your tummy's hurting, you can pay for that out of your health savings account. Well, you could. Because you can't anymore, because they made that all illegal. So guess what's happening? Those patients are starting to go to doctors' offices. Maybe you read about this in the Wall Street Journal just yesterday. A doctor was saying that she doesn't know what to do. Her office is inundated with families who want her to write prescriptions for aspirin. Because if it's written, it'll be paid for out of the HSA. Hello. More bureaucracy, more paperwork, greater expense. The pharmacies are going crazy, they say, because they have to make a label, you know, the label that they make, they have to go through all of that for every one of those medications. And of course, today you can deduct your medical expenses if they exceed 7.5% of your income. In 2013, they'll have to exceed 10% of your income. The Cadillac plans, of course, the unions are exempt, but Cadillac plans, which will probably be every plan because the premium is so expensive, are going to be taxed at 40%. Pretty hefty tax. And of course, as I said, the unions are one of the great companies and the great organizations that get exempted. I want to tell you something very important about how insurance works, because insurance companies get the bad rap, but they're not my best friends either. either, trust me, but we need them. So how does an insurance company make money? Insurance companies make money on their accounts receivable. Did you ever wonder why you pay your insurance policy on a monthly or bi-monthly basis? Wouldn't it make sense for them to charge you once a year? I mean, why send you a bill every couple months, right? How expensive is that? Well, they actually broker their accounts receivable. So they have you tagged. They know who you are, they know how long you're going to live, and they can leverage your premium out 20 years. That's their profit. They manage their expenses. They don't care how high the expenses are, they'll just drive the premium up to match their expenses. So if you look at their balance sheet, you will see that expenses equals premiums. That's exactly how they want it. They manage it. They don't care how many people they have to employ. They will employ them to get that job done. At the same time, their income, the value of that company comes from the fact that they are a brokerage. And they broker and leverage your accounts receivable. So you have to understand how insurance companies work, and that's very important. Because of the kind of practice that I have personally, I have been begging Blue Cross, Blue Shield, anybody, to have what I call the obvious insurance, catastrophic care. Insurance is an actuarial bet. It is not a benefit plan. Do you understand the difference? If you're betting with an insurance company, you're saying, I'm going to bet that I'm going to perhaps become ill. And the insurance company says, we're going to bet that you're going to stay healthy, and here's where we will meet. Here's the balance. Here's what you owe us. Here's where the bet lies. But the bet is based on an unknown. It's an actuarial value. It is not based on a benefit package. If you buy an insurance plan that offers you 3 sets of sunglasses and 25 visits to doctors, guess what happens? Everybody buys 3 pairs of sunglasses and takes 25 visits to doctors. It's a benefit package. Very important distinction. Obamacare and insurance is benefit, it is not insurance. Do you understand the difference? But because the premiums on a catastrophic plan are very low. You know, 25-year-old kids before Obamacare could get insurance at $50 a month. You know that, right? They went online, they bought a catastrophic plan for $25 a month. Simple. It was great, that's what they needed. That was the actuarial bet. It was of value to them. They could afford it, it made sense. Now it costs $250 a month. Because they don't have insurance anymore, they have a benefit package. They have fertility care, but they're not married and they're a male. They don't need it, they don't want to buy it. You're not buying insurance when you buy what we call in the United States insurance. If you could buy insurance, it would probably cost you 10% of what you're already paying. I mean, let's face it, insurance that basically bets against your, God forbid, how many of you have been in a hospital, admitted to a hospital? How many of you have been admitted more than 3 or 4 times in your life? Not too many. It doesn't happen that often. It's the God forbid. If I asked you to raise your hand how many have been in a car accident, the same would answer. It's the catastrophe. Insurance is there to protect you from the catastrophic, God forbid, of a medical illness. And I'll remind you secondhand that the bankruptcies that you hear about are not from medical costs. They're because people who are sick can't work. So wouldn't it make sense if you had an insurance package that you could buy against, for instance, a heart attack? And when you got that heart attack, God forbid, they paid you $50,000 to pay for your health care that you negotiated, and you had money left over to pay your bills and actually go to the grocery store. Doesn't that make sense? It's kind of the AFLAC model. Right, because that's what you need. You need something, right? That's the God forbid. But instead, you get 3 pairs of sunglasses and fertility care. And you're 70 years old. You don't need it. But they'll tell you that, you need to cover the cost. Because when it's offered to everybody, everybody gets it. I used to sit in my office, and a patient would come to see me, and I would say, how can I help you? And I really meant it. How can I help you? Why are you here today? And the answer was, I just got insurance. That was the answer. Now, I'm happy to help them with all the preventive care in the world, but that's not what they were asking. They thought that insurance, they should get something. Right? I understand, I do get it. These huge premiums, but wouldn't it make a lot more sense if you paid less premium, had more choice? Yes? Yes, of course. Okay. We're going to talk about that in a minute a little more. So the medical loss ratio. Blue Shield, I studied Blue Shield. Blue Shield is made up of 120 subcorporations, 120. Every one of them takes 15%, the medical loss ratio. They all take 15% off the top. This is a ruse. This is theoretically what they're using to make sure that insurance companies pay for your care. But what they've done is they've just moved administrative costs, like all that chronic disease management. You know, that nurse that calls you that you don't know who she is, but she calls, hello, I'm calling for your insurance company about your congestive heart failure. What congestive heart failure? You know, the kind that your doctor documented in the claim that you don't have congestive, I don't have congestive heart failure, but that person calls you, right? That's medical care. And the insurance companies will pay for that as medical care, won't even be counted in the medical loss ratio. So it's a ruse, it doesn't mean anything, ignore it. It's just an administrative and an accounting thing. I can explain it to you at length, but it doesn't make any difference because the insurance companies can make it work for them however they want. The estimates aren't credible. We talked about this a little while ago. In '67, the projected cost of Medicare was $12 billion, and the real cost was $110. So who knows what the cost of Obamacare is going to be? The projected cost is $1 trillion. They've already told us that, of course, $500 billion of that, we have to add that because that was really double counted. So we're already at 1.5. They're now estimating $2 trillion. I would guesstimate $10 to $20 trillion. Now, who's going to pay? Let me get my wallet. Ain't gonna happen. Can't happen. Real reform. Okay. So what can we do? What works? Because really, I hate to bitch and moan. Nobody wants to listen to bitchers and moaners, right? We want to listen to people who have plans. So let's talk about what we can do. How many of you would like it if you could go to a doctor's office or a hospital or an imaging center, a pharmacy, anywhere, and see the real cost of that care? Would you like to see it posted? Yes. Would you like to make a choice based on cost and value? Do you think you're smart enough? I think so. So if an imaging center sold an MRI for $400, and another imaging center sold it for $500, you'd want to know, well, what's the difference? The $400 place may be wonderful. The $500 place may say, you know what, Mrs. Smith, we'll do your MRI, and if you wait 5 minutes, we'll give you the result, and we'll give you the CV at the same time, and we'll call your doctor so that you can get care immediately. How many of you would pay $100 for that? Some would, some wouldn't, but isn't it a choice? That's my point. You go to McDonald's, you go to Ruth Chris. It's a choice. You don't even necessarily choose the same every day. If you're having the worst back pain in your life and you want to know what that MRI says, if you're so concerned about your mammogram and you want that result now, and I understand that, well, it may be worth spending the difference. But if it doesn't mean value to you, don't pay it, right? But make us compete. You see, by posting prices and by making us perform, you make me better. I say to my colleagues, and Dr. Narayan knows this because I say this every day, I want you to be better so that I can be better yet again because I'm going to beat you no matter what. And you want doctors with that kind of attitude. You want hospitals with that kind of attitude. You want Long Beach Memorial to compete with Los Alamitos, to compete with Lakewood for your time and money. Yes? Yes. You want them to compete on value. You want them to be clean. You want their service to be excellent. And I'll tell you, we've lost that in this country because there's no competition. It's price fixed. They all get paid the same. That's wrong. If you go to Thailand, by the way, you can go to a you can go to a hospital that looks like a 5-star hotel, where they have excellent service, excellent food, and where you can get your bypass surgery for $7,500. Wow. Now, you know that? It's a choice, right? Competition is good. It makes us better. It makes us accountable. And if you pay for some of that, you'll be accountable to us and to yourself. And it doesn't have to be expensive. So what's the cost of an MRI? You guys have heard me say this before, but I'll tell you anyway. Cost of an MRI is about $350. Cash. I had my mammogram yesterday. It's in my newsletter that you're going to get. It cost me $95.76 for the hospital portion and the doctor portion. I paid by check. Can you afford that once a year? Yeah, cost you $1,000, or you think the cost is $1,000, you don't even go because you think you can't afford it. You get that hospital bill, holy criminy, you can't afford to go back. God forbid you don't have insurance. That emergency room visit for an intravenous because you had some nausea and vomiting was $5,000. When in fact the cost could have been $150. And if they had posted their prices, that's what the real cost is. That bag of IV fluid costs a nickel. A nickel! Now indeed you're paying for all the other services, but it's not $2,500 worth of service. And you go and you'd ask the right questions, and you demand of your doctor in that place that they respond to you. They answer your questions, they spend time with you, because it's your buck, and it matters. Make sense? Transparency, transparency, transparency. You don't know the cost of care, and quite frankly, neither do doctors and neither do hospitals. And that's an atrocity. You cannot assign a value to anything unless you know the cost. That's basic economics, right? Absolutely. So you should know the cost of care, and you should be able to make a choice. You should be able to buy insurance as an actuarial bet, and we need a free market. So in a nutshell, what I think should happen is if we want the government to underwrite catastrophic care for those people who cannot afford it and give them a voucher, I think that's fine. I think they should be able to buy their insurance from any number of private companies that answer to them, and the government should not be selling insurance. Medicare needs a competitor. It needs a competitor. You need to have choice based on price, based on value, based on access, based on all those things. You need choice, and you don't have any. So we need insurance to be an actuarial bet. I don't believe in mandates, so I'm not going to suggest a mandate, and I'm going to tell you even with a mandate, 14 to 15% are not going to do it anyway. But if you make it affordable, more people will do it. If you show value, more people will do it. Outside of that, it should be a free market. You should be able to choose any doctor you want. They should post their prices. They should tell you what they're going to sell you, and damn it, if they don't sell it to you, you should go someplace else. I work for my patients. Pure and simple. I don't do my job, they get to go someplace else. It gives me heartache when I make a mistake. Because you know what? The buck stops right here. I don't get to blame anybody else. And that is my opportunity to be better. I look at it as an opportunity to be the best. And doctors need the opportunity to compete and be better and to serve you, the patient. And Obamacare does everything but that. We need a free market where you choose, where patients get to invest in their lives and invest in their health. That's what self-determination is about. That's what this country was built on. And to think that the thing that you value most in your life, your health, is something that's going to be dictated by the government makes me nauseated. I have medicine for that, but I'd rather not. So what can you do? Right now, always ask the cash price. Always ask. If you want an MRI, ask what the cash price is. If you want to go see a doctor, ask them if you can pay cash. Make them accountable. You can do that, you know. Outside of Medicare, there are ways you can do it, and I can show you how. I told you about my mammogram. Make your doctor work for you. Your doctor doesn't work for you, go someplace else. Don't wait around. And certainly don't wait for Obamacare to be your answer. But in the meantime, you can start establishing a market for yourself. We can do it right here. And finally, your health is your life. There's nothing more important to you, to your family, to your friends. We don't live in a vacuum. We live in a world where we need something to everyone. It's important. These are the most important investments that we can make. They belong to us. They do not belong to the government. I'm not giving mine up, and I'm not letting the government take it from you. Your rights, as we talked about, choice, self-determination, personal investment, individual health care versus population-based health care. We'll talk about that maybe in the question and answer session so that we can move on. And of course, we talked about it. Write your congressperson. Write your senators. I know we live in California. We're a crazy state. And your senators are not going to listen to you. That's another story. But write to them anyway. And guess what? Feinstein's up for office. She's running. Let's find somebody to run against her. Let's find somebody who will answer to us. This is, say again, listen, if you can't open wider to swallow this, we might have to try the other end. That's it. I'd be happy to take questions, but I can't answer now because I know you might want to get home. I will leave my email address. You can call me, you can write me, you can text me, you can send a carrier pigeon. I will find the answer for you if I don't have it. And I thank you very, very much for coming.